Effect of preemptive use of non-steroidal anti-inflammatory drug and a corticosteroid on the efficacy of inferior alveolar nerve blockade and post-operative pain control in endodontic treatment of molars with symptomatic pulpitis, a randomized double-blind placebo-controlled clinical trial. The anesthetic success rate of inferior alveolar nerve block is quite low in patients with symptomatic irreversible pulpitis and mandibular molars ranging from 58% to 79%. In the post-operative period following endodontic procedure, approximately 47% of patients report moderate to severe pain with a higher incidence between 6 and 24 hours. According to a recent systematic review, dexamethasone is effective in relieving painful symptoms following root canal therapy in teeth with symptomatic pulpitis. Due to its anti-inflammatory properties, it may also improve the inferior alveolar nerve block success rate. On the other hand, diclofenac is the most widely used NSAIDs in the world. The aim of this study was to evaluate the preemptive oral administration of 50 mg diclofenac potassium and 4 mg dexamethasone on the anesthetic success of inferior alveolar nerve block in mandibular molars with symptomatic pulpitis. Another objective was assessing the influence of the two drugs on the occurrence of post-operative pain. The study was carried out in a private practice located in Sao Paulo, Brazil, between September 2021 and January 2023 by a single operator, an endodontic specialist with 12 years of experience. It is a randomized, double-blind, operator and patient, placebo-controlled clinical trial. 82 patients included in the analysis whose age ranged between 18 and 45 years. Patients were healthy and had a molar with symptomatic irreversible pulpitis, diagnosed by history and clinical tests including endo-eyes and BA's radiograph to rule out presence of periapical findings. The diagnosis was confirmed by bleeding from the pulp once entered. For preoperative pain assessment, each eligible patient rated the intensity of their spontaneous pain using a numerical rating scale 0 to 10. Randomization was done through random and sequential draw using Microsoft Excel. All three drugs, dexamethasone, diclofenac, and the placebo, which was 50 mg lactose, were sealed in the same looking container and provided by dental assistant not involved in the clinical procedure. Patients randomly received one of the three drugs 1 hour before the procedure. They all received inferior alveolar nerve block using 4% articaine with 1 to 200,000 epinephrine. After 15 minutes and checking for lip anesthesia, cold test was performed to assess the success of anesthesia. If failed, anesthesia supplemented with buccal infiltration of 4% articaine. After 4 minutes, cold test carried out again to confirm pulpal anesthesia. The root canal treatment done with reciproc files and obturating using AH plus sealer with single cone technique. Each patient received a numerical rating scale to record the degree of sensitivity at 6, 12, 24, 48, and 72 hours after the endodontic procedure was completed. All patients were instructed to take a 400 mg ibuprofen tablet orally, a rescue medication in case of persistent pain, and to write down the time and day of use if necessary. This table 2 shows there was no significant difference in anesthetic success in relation to the use of dexamethasone or diclofenac potassium when previously administered orally, but the use of both drugs shows statistically higher anesthetic success rate than the use of placebo. 66 patients required anesthetic supplementation, including 22 in the diclofenac group, 17 in the dexamethasone group, and 27 in the placebo group. For post-operative pain, only in the group that received corticosteroid was post-operative pain significantly lower in the 6-hour evaluation. In the group of preemptive medication, the pain at 6 hours post-operative was significantly lower after 24 hours only compared to placebo group that shows significant reduction only after 48 hours. 22 participants needed rescue medication, with the 3 belonging to the diclofenac group. and one belonging to dexamethasone group, and needed the medication for the first 6 hours post-operatively. According to Kaplan-Meier curves, there was a statistically significant difference in the survival curves of preemptive medication without the need for rescue medication in the group placebo in relation to dexamethasone and diclofenac potassium groups, which did not differ significantly from each other. In conclusion, with the limitation of this study, it can be concluded that the preemptive administration of dexamethasone or diclofenac potassium should be indicated in the inferior alveolar nerve block, increasing its success rate and decreasing post-operative pain.